Hello, I'm Rob Diller with DocWire News. We're joined today by Dr. Saad Usmani, co-author of the Pegasus study, which assessed treatment regimens in patients with newly diagnosed transplant-ineligible multiple myeloma. Thank you for joining us today, Doctor.
Thank you for having me.
Okay, so let's jump in. Tell us a little bit about this study as far as the background and the methodology, and also go into the findings.
Sure. The Pegasus study used individual level patient data from the randomized open label study called the MAIA, which had compared the combination of daratumumab, Lendex with Lendex for relapse refractory multiple myeloma with existing Flatiron Health electronic medical records from DA identified patients. And the rationale to do this study was the fact that VRD is utilized for a lot of the frontline transplant-ineligible patients, as is VD. And we wanted to see, in absence of a clinical trial setting, what would be the real world outcomes of this comparison. So this is an indirect treatment comparison between the DRD arm of the study compared to Bortezomib-Dexamethasone as well as Bortezomib-Lenalidomide and Dexamethasone.
And what were the findings?
The findings demonstrated that, again, with the caveat that this is an indirect patient comparison, the DRD patients did well in terms of progression-free survival. And the way that the patients were matched had to do with their patient characteristics at the time of diagnosis compared to the patients in this particular database. So this is an indirect comparison, but did demonstrate that the three-drug combination that's daratumumab based had better progression-free survival outcomes compared to the doublet and the triplet in that particular data set.
And did these findings surprise you at all?
These findings, are welcome, I would say. I don't think that we are going to have a direct comparison between these three drug combinations in the context of a clinical trial. I was always curious about, the outcomes of patients with one versus the next. At the very least, what we can confidently say is patients who are being treated with the daratumumab-based triplets won't do poorly compared to the VRD patients that were treated in the real world setting.
And as far as limitations, were there any study limitations that you like to report?
Yeah, I think, the big limitation of this study is the fact that this is not a randomized controlled trial. That's our golden standard. But in the absence of that, I think this is as close as you're going to get to seeing some sort of a comparison between the real world treatment of patients in the transplant-ineligible setting with the three-drug or a two-drug combination compared to the daratumumab-based triplet.
What would you say are some of the key takeaways from the Pegasus?
I think the key takeaway from this experience, is that patients, we've had a very good comfort level with patients being treated with, say, bortezomib-based combinations for this patient population. And this is a bortezomib-free daratumumab Lendex-based combination. And what the key takeaway is for older patients, this appears to be safe, it appears to be effective, and can be utilized for these patients.
And is there anything else you'd like to add, Doctor?
No, I think that this is about it. I just want to highlight the fact again that this is not a trial. This is an indirect comparison of treatment between the patients who were treated on the MAIA, comparing them to this healthcare database with de-identified patient information.
Well, we thank you so much for your time today. I know you must be a busy man. Thank you very much, Dr. Usmani.
All right, thank you. Take care.
All right. I'm Rob Diller with DocWire News. Until next time, everybody, stay safe.